The NHS may be in danger as staff numbers could fall by up to 250,000 by 2030, according to the BMA. However, the NHS is trying to combat this by replacing the 2-year core medical training programme with a 3-year internal medicine training programme for junior doctors. This may fix staff shortages in the short term, but this could affect junior doctors in the long run in terms of training and morale. CMT is flexible enough so that doctors have some sort of input of what types of jobs they would like to do before they specialise, and it may even link to their chosen specialty. However, IMT is a rigid structure which forces junior doctors to do certain job roles such as intensive care or care of the elderly. This may seem like it's benefiting the NHS, but will this actually stretch out the thin numbers of staff that they already have, and at what cost?
Chloe Doan will be one of the first junior doctors under the IMT programme. She welcomes the move done by the NHS as she wants to specialise in care of the elderly. She talks about the importance for doctors to have more general medical training in hospitals before picking a specialty in medicine.
People need to be trained more on how to discharge patients, especially patients with much more complex needs like geriatric patients, and having those extra years, those extra general years as a SHO are going to be much more important in being able to have those skills.
Visiting London CMT representative Lucy Gorrod at her home, she speaks to a colleague on the changes that are being made in their training. As a doctor who is about to complete her CMT programme, the new move isn't welcomed. She may have to complete a 3rd year, which will cut into her specialty training, leaving her 1 year less informed on how to do certain procedures.
The thing that I'm not so sure about is if you're then doing an extra year in the general medical registrar field, you're then having 1 less year in your specialty. So, for example, if you want to go into gastroenterology, one of your skills is going to be doing endoscopy, so camera tests. If you're doing an extra year in this IMT setting compared to the CMT, where you're doing this 1 year extra as a registrar at the end of the 3rd year, and then 1 year less as a gastroenterology registrar, that means you've done 1 less year of endoscopy before you would then, at the same time, regardless of which course you've done, end up being consultant.
Catherine Tang, Kent Current.